Good morning, one and all. Today we are going to see about yoga and health. Health. Health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. WHO 1946. Health is the level of functional or metabolic efficiency of a living being. In human, it is the general condition of a person's mind, body, and spirit, usually meaning to be free from illness, injury, or pain. The dimensions of health: physical, intellectual, emotional, social, and spiritual dimensions. The physical dimension: eating, even walking 30 minutes a day, three times a week will generally improve your health. Eating healthy, avoid fried foods, soft drinks, processed meats, and sweets. Try to include 5 servings of fruits and vegetables in your diet every day. Don't skip meals, especially breakfast. It slows down your metabolic rate and can cause weight gain. Avoid heavy episodic drinking and drug use. No more than 5 drinks in one sitting for men and 4 for women. Don't play drinking games and space drinks over time, altering with a glass of water. Get at least 6 to 8 hours of sleep every night. Emotional dimensions. Try to maintain a positive attitude even when problems arise. Discover your personal stress reliever. Manage your time wisely because it will help lower stress. Find out someone who trusts you can openly share your feelings with. Need to talk. Go see a peer med. Seek professional help when you need it. Smile even when you don't feel like it. Social dimensions. Get involved. There are a variety of clubs organized on the campus. You are bound to find something that interests you. Know who your best friends are. Recognize when you are in an unhealthy relationship. Balance your social life with your academic responsibilities. Spiritual dimension. Find a quality place and spend time there every day. Contemplate the meaning of your life. If you have a religion, study and practice it. Spend time appreciating the natural world around you. Intellectual. Keep abreast of current affairs. Take your school work seriously and spend time in the library. Seek academic help if you need it. Become a lifelong learner. And disease. Disease is an abnormal condition affecting the body of an organism. It is often constructed to be a medical condition associated with specific symptoms and signs. It may be caused by external factors such as infectious disease, or it may be caused by internal dysfunctions such as autoimmune diseases. Lifestyle diseases. Lifestyle diseases include high blood pressure, heart disease and stroke, obesity, cancer, and type 2 diabetes, mellitus, and diseases associated with smoking, alcohol, and drug abuse. Now we are going to see about hypertension. Hypertension means high blood pressure. High blood pressure is increased pressure in your blood vessels, and therefore there is less space of your blood to travel through. It is a common disease affecting the heart and blood vessels. The normal value of a blood pressure in adult is 120 by 80 millimeter of mercury. So that is what the systolic and diastolic pressure includes. And the causes for it. The causes are like hereditary, obesity, stress, high cholesterol, inadequate activity, psychological, physiological, and environmental factors. Even the psychosomatic factors included in it. Common misconception is that aging causes excitement, and at certain emotional moments the high blood pressure causes. The symptoms are lack of strength, tiredness, headache, difficulty in breathing, visionary troubles, coldness in the hands and feet. And the things to avoid: stop smoking cigarettes and use of tobacco in any form. Alcoholic drinks should be avoided. Intake of ghee, butter, creams, eggs, meat, excessive fat containing food items should be avoided or stopped. The yogic management for this high blood pressure is: yoga is an excellent means of treating high blood pressure. Asanas make the arteries and capillaries elastic and allow more blood to flow into various areas, resulting in better relaxation of those tissues. The treatment is comprised of 3 steps, that is, observance to certain principles and advice, eating proper diet, practicing yoga on selected basis. The suggested practices are asanas, pranayama, kriya, and diet too. So the asanas are few mentioned here, that is Ardha Gati Chakrasana, Ardha Machendrasana, Bhujangasana, Ushtrasana, Vajrasana, Shavasana. The pranayama mentioned here are sectional breathing, Nadi Shuddhi pranayama and Brahmari pranayama. And the diet, when we talk about it, it consumes less salt and fat, and eat every day leafy vegetables in a higher quantity. Next we move on to the diabetes mellitus. Diabetes mellitus, it is a metabolic disease in which the hormone insulin secreted by the pancreas is a deficiency in quantity or sensitivity. As a result, the blood sugar level becomes high and uncontrolled. Type 1 disease. Type 1 diabetic mellitus. It is the insulin-dependent diabetic mellitus, or also called as the juvenile onset diabetes mellitus. So it is in general called as IDDM. The insulin administration is compulsory. It can occur at any age, commonly occurs during the younger age. And type 2 diabetes is nothing but with a non-insulin dependent diabetes mellitus. It is also called as a maturity onset or NIDDM. This type is very common and occurs after the age of 40. Here, additional insulin is not required, but still the hormone insulin at near normal or even above normal. Defects are due to the molecular machinery that mediates the action of the insulin on its target cells. And the causes for it are dietary abuse, lack of exercise, hereditary, stress and frustrations, obesity, etc. So when we talk about the dietary abuses, intake of a high amount of sugar, carbohydrate and rich diet, overeating, this all will be caused as the dietary abuse. And then hereditary, it is the plays the most important role in the conferring susceptibility to diabetes. The closer the blood relationship of a person to a diabetic, the greater chance of developing the disease. Stress and frustration and obesity. Stronger dispositioning factor in middle-aged diabetes is obesity. The symptoms are polyuria, frequency of urination, and polyphagia is excessive hunger, polydipsia, excessive thirst, frozen shoulder, pain in the shoulder, lethargy, weight loss, easy susceptibility to infections, particularly skin. Normally, the fast level of blood glucose is less than 90 mg per dl and the postprandial is less than 120 mg per dl. The postprandial sugar level is between 150 to 200 mg per dl. It is impaired tolerance if above 200 mg per dl. It is frank diabetic. The yogic management of it is: yoga is suited for both types of diabetic mellitus. In IDDM, asanas help to prevent an increase in insulin requirement, and in NIDDM, asanas help to normalize blood sugar during the high intensity workout. In the initial stages, the patient can start yoga practices without stopping the medicines or injections. After practicing yoga for 3 weeks, you can gradually start reducing the intake of medicines. And the suggested practices are asanas, pranayama and meditation, standing poses and a few of the twisting poses, backward and forward bends and triangle pose, Bhujangasana, Dhanurasana and Shavasana, Sarvangasana. The pranayama or Vivekya pranayama, that is the sectional breathing, Nadishuddhi pranayama is the balancing breathing, and then Bhramari. And meditation, silent meditation for 15 to 20 minutes will result in the practice. Thank you.